Many people don't realize that common medications they take regularly could be silently damaging their brain and accelerating cognitive decline. Whether you're using something for seasonal allergies, trouble sleeping, feelings of anxiety, mood concerns, or bladder issues, certain widely used drugs might be putting your mental health at serious risk. Research shows that daily use of specific medications for just 1 year could potentially increase dementia risk by half, and extensive scientific evidence from numerous large-scale studies demonstrates clear connections between these particular drugs in both brain tissue loss and cognitive impairment. These aren't rare or experimental treatments we're talking about. They're standard medications that millions of people have in their homes right now, often taking them without understanding the potential long-term consequences. It's crucial to understand which medications pose these risks and how they're quietly affecting brain function, as well as what safer options might be available. This information is particularly important to share with family members who might be unknowingly compromising their cognitive health through regular use of these common drugs. The medications of concern belong to a category known as anticholinergic drugs, which essentially means they interfere with a critical brain chemical called acetylcholine. This neurotransmitter functions like the ignition system for your brain, enabling neurons to communicate effectively with one another. Acetylcholine plays essential roles in memory formation, attention span, and even basic muscle movement. When these drugs are used consistently over time, they essentially disrupt your brain's internal communication network, causing neural signals to become progressively weaker and ultimately leading to memory problems and cognitive decline. What makes this particularly concerning is how widespread these anticholinergic medications are in everyday healthcare. Common allergy treatments like Benadryl contain these brain-blocking compounds. Popular over-the-counter sleep aids, including Tylenol PM and Unisom, also fall into this category. Certain anxiety medications, such as hydroxyzine, which may also be prescribed under names like Vistaril or Atarax, belong to this same drug class. Bladder control medications like Ditropan and Detrol are anticholinergic as well. Even treatments for digestive issues like Bentel and motion sickness patches containing scopolamine share these same brain-affecting properties. The concerning reality is that these medications, whether prescription or over-the-counter, all create similar interference with brain function. Scientific research consistently supports these concerns about cognitive risk. A comprehensive, systematic review analyzing data from over 1.5 million individuals confirmed that anticholinergic drug use represents an independent risk factor for developing both general dementia and Alzheimer's disease specifically. The research also revealed that greater exposure to these medications correlates with higher dementia risk. Another significant meta-analysis examining 21 separate studies found that using anticholinergic medications for more than 3 months increased dementia risk by an estimated 46% compared to non-users. Just 3 months of regular use resulted in nearly a 50% increase in cognitive decline risk, and many similar studies have produced comparable findings. Perhaps most alarming was research published in JAMA Neurology that used advanced brain imaging and metabolic analysis to show that anticholinergic medication use was directly associated with increased brain shrinkage and impaired brain function. This isn't simply about feeling mentally sluggish or experiencing temporary confusion. These drugs actually alter the physical structure and size of brain tissue while disrupting normal brain metabolism. Understanding these mechanisms helps explain why long-term use of these medications can be so damaging to cognitive health. The underlying problem occurs because acetylcholine normally binds to specific receptor sites on neurons, particularly muscarinic receptors, which facilitate essential communication between brain cells. These muscarinic receptors are crucial components of the parasympathetic nervous system and exist throughout the body, not just in brain tissue, but also in the heart, lungs, and digestive system. This widespread presence explains why these drugs can effectively treat symptoms like nausea, digestive spasms, or overactive bladder function. However, within the brain, these same drugs block communication in critical areas, including the hippocampus and cerebral cortex, which are absolutely essential for memory formation and cognitive processing. Short-term effects of these medications can include mental fogginess, confusion, and delayed reaction times, With prolonged use, however, the damage becomes permanent and includes actual brain tissue shrinkage. This problem becomes especially pronounced in older adults because natural acetylcholine levels already tend to decrease with age. Taking medications that further reduce acetylcholine activity essentially accelerates this natural decline, effectively cutting off one of the brain's primary communication pathways. The longer this interference continues, the more extensive the resulting damage becomes. This doesn't mean these medications should never be used under any circumstances. Taking Benadryl occasionally for a night or two when sleep is elusive, while not ideal, probably won't cause significant harm. Sometimes Benadryl is necessary for severe allergic reactions, and certain situations require these medications for urinary incontinence or irritable bowel syndrome. The key is avoiding daily use for months or years at a time. This precaution becomes especially critical for individuals at higher risk, including people over 60, those already experiencing memory issues, or individuals taking multiple anticholinergic drugs simultaneously. Taking multiple anticholinergic medications is surprisingly common in clinical practice. Someone might use hydroxyzine or Vistaril for anxiety management while also taking Benadryl or Unisom for sleep, and possibly using Ditropan for bladder control. While each drug individually blocks some acetylcholine activity, together they can shut down major portions of brain and central nervous system function. The first step in addressing this issue involves thoroughly reviewing all medications, both prescription and over-the-counter, to identify any anticholinergic drugs. Online resources, doctors, or pharmacists can help determine which medications fall into this category. However, it's absolutely critical never to stop any medications or make changes to treatment regimens without first consulting with a healthcare provider. Discuss with your doctor whether safer alternatives might be available, especially for medications needed long-term. For sleep issues, non-anticholinergic alternatives might include melatonin, ashwagandha, chamomile, or magnesium, though the specific form of magnesium matters for sleep effectiveness. Prescription alternatives like trazodone have minimal to no anticholinergic effects while remaining effective for sleep disorders. For allergy management, second-generation antihistamines such as Zyrtec, Claritin, or Allegra are preferable to Benadryl because they have minimal penetration into the central nervous system and brain. While these second-generation antihistamines are technically still anticholinergic, they're much less likely to cause problematic anticholinergic effects. For bladder control issues, medications like oxybutynin, Ditropan, Detrol, or Vesicare might be replaced with non-anticholinergic options like Myrbetriq. Those suffering from irritable bowel syndrome who've been prescribed drugs like Bentel should discuss alternatives such as peppermint oil with their healthcare providers. Other prescription options exist depending on whether the IBS primarily involves constipation or diarrhea. If you've been using these medications for extended periods, there's no need to panic, but you can begin optimizing brain health immediately through regular sleep, consistent exercise, and addressing other risk factors that contribute to cognitive decline and dementia. This includes managing insulin resistance, high blood pressure, and heart disease. Taking proactive steps to support brain health while working with healthcare providers to find safer medication alternatives can help protect cognitive function for years to come.